In today's video, I'm going to go through exactly what you need to do in the early stages with your rehabilitation after you've had a knee replacement. And keep watching until the end of the video, as I'll be giving you some useful hints and tips about what to expect along the way. And I'm going to start right now. It's important to know that for the majority of people, you will be allowed to fully weight bear directly after the surgery. This means that you will be allowed to put a normal amount of weight through the affected limb straight after the operation. Now, the main barrier to this is going to be the amount of pain you experience. So priority number one after the surgery is to get on top of your pain as quickly as possible with appropriate pain medication so that you can complete the rehabilitation. If you are struggling to complete the rehabilitation because of the pain, that is likely to slow down your recovery. The exercises that we're going to go through today are exercises that you can complete day one post-op, or depending on what time you have the operation, even potentially the same day. So we're going to start off with some ankle pumps, and very simply, you're just going to bring your toes up towards you, slowly away, up towards you, and slowly away. Now this could help with swelling if you have developed any swelling in the calf or the lower limb, and it can also help with any calf tightness that may have developed over the last few days. We've got the ankle moving, and now we need to get the knee moving. Now you might be reluctant to do this, but be aware the replacement that you've had is a very strong and stable structure. It will be uncomfortable, it will be tight, it will be painful, but you're fine and safe to bend and straighten the knee as your pain allows. The pain you're getting is not a sign that you're doing any damage. It's a sign that there's some inflammation and some swelling and other secondary compensations that are going on around the soft tissues, but you are fine to move the knee. So very simply, you're just going to bend the knee and slowly lower it down. Like I said, it is likely to feel uncomfortable initially, but you might actually find that your pain improves as you move the knee more. Now, in hospital, they will be probably quite keen on aiming for 90 degrees of flexion in the knee before they discharge you. 90 degrees equals a right angle at the knee, and normally at this stage, they would be happy to let you leave the hospital. The other movement that you need to try and get back is your extension. That's how straight you can get the knee. Now, it is definitely worth having a chat with your consultant before the surgery or afterwards, if you haven't had a chance to before, about how much extension they are expecting you to get back. If you have been walking with an altered gait pattern for a prolonged period of time, and I often see patients that have done this for many years, it may be the case that you're not going to get full extension back, but it's good to know that before the surgery so you know what you're aiming for. With this exercise, I've rolled up a towel, placed it underneath my heel, and you're aiming to push your knee down into the bed. So bring your toes towards you, contract your thigh muscle, so squeeze and tense the muscle, and hold for as many seconds as you can. We're going to aim for 5, 4, 3, 2, 1, and then relax off. And then bring your toes towards you, squeeze again, push down, hold for 5, 4, 3, 2, 1. You might find initially you're only in this sort of position, but hopefully as you practice, you'll improve. For this exercise, you're going to move the towel further up the bed and underneath your knee. Now, we're working on the same thing again. We want to wake up your quadricep muscles. These are the muscles at the front of the thigh. You're going to push down on the towel, pull your toes towards you, straighten the knee, and tense your thigh. It should feel nice and firm when you push it with your fingers, and then you're going to slowly lower down. And then contract the muscle, toes towards you, squeeze for 5, 4, 3, 2, 1, and relax. Now, a quick note of caution, whilst the towel is here, you may find it uncomfortable to have your knee in a straight position for a long time, but it's really important to try and get the knee as straight as possible as soon as possible. It's vital when we're trying to get back walking normally again. What a lot of people do, because it is more comfortable, is sleep with or have a towel under their knee for prolonged periods, and all this does is force their knee out of that straight position that we're actually looking for. So do try and avoid prolonged periods with the towel underneath the knee unless you're doing a specific exercise. I'm going to interrupt just for a second to say if you would like to know any more about osteoarthritis or any other pain and rehabilitation related issues, then hit that subscribe button so you get notified every time I release a new video, which I do every single week. Thank you very much for watching and enjoy the rest of this one. Moving on to a slightly harder exercise for your quadricep. Again, we're going to do a straight leg raise. Now, that is what it says on the tin. So you're going to bring the toes towards you, contract your thigh muscle and try and lift the leg straight off the bed and slowly down. Now, that looks quite easy for me. I haven't had a knee replacement, but what you will find is the leg will feel very heavy straight after you have had the surgery, and it might feel like you can't physically lift the leg off the bed. But keep practicing this one, because as you do more of it, as you get the thigh stronger, this will be a nice objective marker for your progression. You may find after the first week you can only get it to here, but by the third or the fourth week you can get it a lot higher. We focused a lot on the muscles at the front of the thigh. We now want to try and get the muscles at the back of the thigh woken up a little bit. So you're going to bend your knee to whatever degree you feel comfortable. So let's say here, and you're just going to push your heel down into the bed. So you're going to hold on with a bit of support, but you're trying to contract this muscle here and then relax. Push down into the bed, hold for 5, 4, 3, 2, 1, and then relax off. There are a few exercises that you can do in sitting during the early stages of your knee replacement as well. And one of those is some heel raises to work on your calf strength. Now you're going to bring your heels slowly off the ground and then back down, slowly off the ground and then back down. If you really want to accentuate this as a strength exercise, then at the end of the range, really try and push your toes down, bring your heels off the floor as high as they will go and really feel a nice contraction in that calf muscle. Another exercise that you can try in sitting is seated knee extension. So have your feet flat on the floor to begin with, make yourself comfortable, and then you're going to try and straighten your knee and then slowly down. Similarly with the other exercises, if you want to try and bring your toes towards you and really squeeze that thigh muscle hard, that is just going to accentuate the strength aspect of things slightly more. It is also a good idea to try the opposite of this. So some seated knee flexion to try and get the knee slightly more bent. So start off with your foot out in front of you and you're going to slide your foot towards you and then slowly away and slide your foot towards you and slowly away. If you get to the end of the bend and you can tolerate keeping your knee in that position for a little while, like a stretch, then feel free to do so. Now, before we move into the latter stages of the rehab in the next video, there are still a couple of things that are a good idea to practice in the first couple of weeks. The first thing is weight bearing. The second thing is walking. So with regards to practicing weight bearing, do it somewhere where you feel comfortable and safe and that you have some support. We're going to use the chair. So stand up with your hands over whichever surface you're using. And it's fine to have more weight on the unaffected side. We'll say the right is the affected side initially. But over a period of time, you're trying to build up so that you feel comfortable having more weight on the affected side. And when you feel comfortable, you can build that up to a single leg stand with some support. Now, we mentioned earlier that your movement is really important to get back. And the reason for this, or one of the reasons for this, is because it's so important to try and get a normal walking pattern as soon as possible. So it's a good idea to practice this for a couple of minutes intermittently throughout the day. So just so we know, a normal walking pattern should involve having a bent hip when you stride through, a bent knee, and then when your heel touches the ground, you should have a straight knee. And this is the really important part. So you may want to practice this and really exaggerate the movement. You can pretend you're walking over some hurdles, or you're walking on the moon. But over-exaggerate the movement, do it somewhere where you feel safe and you can put your hands down if necessary, but try and practice a normal gait pattern intermittently throughout the day. I hope you found today's video useful. There is some additional information in the description below the video to help you manage your osteoarthritis or joint replacement better at home. And I'd love to hear from you, so drop me a comment and let me know which exercise from today's video you found most useful. If you are new to the channel, then hit that subscribe button so you get notified every time I release a new video, which I do every single week. And if you're feeling really generous, you can show your appreciation by giving us a thumbs up. If you have found today's video helpful, you may also like the video that I have put together on what to expect after a joint replacement. And there is a whole playlist on the channel about how to manage your osteoarthritis better at home. Thank you very much for watching, and until next time, I will see you again very soon.